breast cancer impacts 1 in 8 women. In this Women's History Month, we want to focus on initiatives that are raising awareness for all women.
Breast cancer education is critical for women, and earlier because women are getting diagnosed younger and younger. We are here now with Lindsay Livingston, founder of SurviveHER, and Yolanda Lopez, program manager of cancer survivorship with Houston Methodist Sugar Land. First of all, ladies, thank you so much for being here.
Well, thank you for having us.
Okay, Lindsay, let's start with you because you have an incredible story, and that really is part of your message, is to keep the education going and keep telling women how important this is.
Well, Sophia, I was diagnosed with triple-negative stage 2B breast cancer in July 2019, underwent 15 rounds of chemotherapy, a bilateral breast mastectomy, breast reconstruction. I had my ovaries and fallopian tubes removed because I carried the BRCA1 gene mutation, all within a span of 15 months. And after I conquered cancer, I started SurviveHER to raise awareness, to inform, inspire, and empower women, because I did not have the knowledge or the information to really, and I was not equipped to even conquer this disease. And so now my mission, my calling over my life, is to help women navigate their way through this breast cancer, what could be a very critical and challenging, daunting breast cancer journey.
Well, we know being a survivor, you don't get there alone. And you guys have a partnership as well. Can you talk a little bit about what you do at the hospital and how the partnership works?
Absolutely. So we are proud at Houston Methodist Sugar Land to partner up with SurviveHER. It's been a 3-year journey and continuing. My role at the Sugar Land Hospital is to provide survivorship support to patients and their families, right? Because right after you are diagnosed, you're treated, and then you're cancer-free. Yay! But what happens to you at that point, right? There are a lot of physiological and emotional and spiritual changes that occur within that survivor that nobody talks about. So our program basically partners up with other survivors and family members and subject matter experts to help them continue and thrive within that post-treatment of their cancer journey.
Yeah, because it is such a long journey. It's things that people may not think about, all right? Tell us about the importance of providing access to resources from the start of the diagnosis to post, beating cancer.
So it's important that women are empowered with not only information about making informed decisions about their breast health, but gaining access to resources, whether it's financial resources, whether it's access to treatment. And so we understand at SurviveHER the power of partnership and collaborating with Houston Methodist Sugar Land's Neal Cancer Center in providing those access and resources to bring those to the community, to women who need them most. When you ring the bell after completing chemotherapy, for example, or radiation treatment, your journey is not over. And so you need those supporting resources and access to community and support groups to help you navigate, keep on keeping on. And that's really what our message is all about.
Is there a particular part of the journey that is most difficult, that early time when you're just finding out about it? I mean, I imagine the actual treatment itself has to be physically demanding, and now at the end, when you think, okay, I'm scot-free, I'm in the clear, there's actually more to be done. Is there one part of it that's the most difficult?
I would have to say the emotional aspect and the mental health aspects are really, really challenging. Just facing your day-to-day, will there be a recurrence? What are my side effects? How am I managing neuropathy or lymphedema? Or for me, it's hot flashes because I'm in medically induced menopause. So there is a lot of management that's going on in survivorship. And so through our work and through initiatives like Treat Her, we're helping women to navigate all that comes with not only surviving cancer, but just also learning about the risks, signs, and symptoms of breast cancer.
And Yolanda, I'm sure that you've had conversations with women that are part of the program. What have they said, about being part of this program, cancer survivorship?
Well, it's the initial fear, right? From the point of diagnosis, and then they're going through fear and through grief throughout their treatments, because again, they're losing parts of their bodies that were important to them, that made them feel who they were as women. So we not only treat them medically, but we are there psychosocially to help them through that journey. So through these survivorship programs, we're able to bring people together that can share their stories stories and their testimonies and provide hope and encouragement to each other, right? Because everybody's at a different stage, whether it's pre, post, or even just going through the treatments. We're able to provide that support within these groups.
And how can women find you guys and what you do if they need some of that support themselves?
So they can visit us on social media, SurviveHER, or I'm a SurviveHER is our website, .org. And I want to just tell you quickly about our event that we're partnering together to host for their third installment, Treat Her, which is SurviveHER's signature breast education and prevention program. We are treating women, almost 100 women, in partnership with the City of Missouri City to an experience of education, resources, access to education. They'll learn from a renowned breast cancer specialist from Houston Methodist. They will be treated to a complimentary lunch, a wellness, fitness experience, and so much more. We're all about curating this community environment for survivors and supporters so that no woman feels alone in her journey.
Yes.
This is a great introduction then to what you do at this
Yes.
free event, so it's beautiful.
Lindsay, Yolanda, thank you so much for being here with us.
Thank you for
this
having
morning.
us.